Good morning. Sorry for the delay in starting. Maybe a brief introduction. Dr. Ruth Kagere. I'm going to be taking you through anatomy of the nose and paranasal sinuses for this Monday. Then next week we shall be going through acute sinusitis, and yes, that will be for the coming Monday. So I hope everyone at least got to look at the notes before. I shared them way earlier on the LMS on the system. So I think they should be available for everyone. Okay, so we're going to be going through anatomy of the nose and the paranasal sinuses, and I guess you're getting my screen share, or if not, at least you have them somewhere. So we'll go through the anatomy of the anatomy of the external nose, then the nasal cavity, and then paranasal sinuses, together with the relevant clinical approach to everything. So external nose is shaped like a pyramid with its root facing up, and the base is directed downwards, which is the base. It consists of a osteocartilaginous framework, which is covered by muscle and skin. I think if you touch your nose, you can be able to see that. The osteocartilaginous framework, the upper third is made up of bone, while the lower 2/3 is cartilaginous, and this is evident even when you touch your nose. The upper part, which is supposed to make the apex of the pyramid, is sort of bony, while when you come to the lower 2/3, it's a bit soft, and it's cartilaginous in consistency. So we have the bony framework composing of nasal bones, the nasal process of frontal bone, the frontal process of the maxillary bone, while the cartilaginous framework will have the upper lateral cartilages, the lower lateral cartilages, which is the same as the ulnar cartilages, and the lesser cartilages, as well as the septal cartilage. In this image here, I think you can be able to see this upper part, which is composed of this is the nasal bone. And when you see laterally, which is this, it is the frontal process of the maxilla. So this makes up the upper third of the nasal, the external nose, while the lower 2/3, as you can see, is composed of cartilage. And this is the upper lateral cartilage. So we have the paired cartilages, which is the upper lateral cartilage, then the ulnar cartilages, and in there, in the middle, I think you can be able to see the septal angle where the septum is able to attach to those cartilages. So there's what we call a nasal valve, and this is formed by the lower edge of the upper lateral cartilages and the anterior end of the inferior turbinate. So we can be able, this is important in such a way that it's what determines air entry into the nose. In case of obstruction of the nasal valve, then someone is not able to breathe through the nose. So one of the tests that we can be able to determine obstruction is what we call a Cottrell's test, and this is basically you lateralize the cheek. And if the problem of the nasal obstruction is within the nasal valve, when you lateralize the cheek, as you can see in the picture, the part will feel better because they are able to breathe better because you're opening up the nasal opening, right? So apart from the bony and the cartilaginous part of the nasal cavity, the external nose, we have the musculature, and this is basically part of the muscles of the facial expression. So I think in anatomy, you've been able to look at some of these or all of them. And muscles that are directly connected to the nose, we have the procerus, the nasalis, which is the transverse and the alar part. Then we have the levator labii superioris, alar kinasi, and then anterior and posterior dilator naris, and depressor septi. So when you look at the muscles of the facial expressions, those that are surrounding the nose, this is what you get as part of the external nasal cavity. So for the external nose, we shall go to the blood supply, where you get arterial blood from ophthalmic and facial arteries, and this is drained by the the facial and ophthalmic veins. Our lymphatic drainage is via the preauricular and submandibular lymph nodes. I hope we all have an idea where these are. The preauricular, as the name states, they are anterior to the external ear, and the submandibular lymph nodes are in the submandibular region. So we shall go to the nasal cavity. It is divided into right and left nasal cavities by the nasal septum. And each nasal cavity consists of a skin-lined portion of the vestibule. This is the anterior part of the, when you look into someone's nose, or when you look into your nose from the mirror, this is the part that contains the hair follicles, the vibrissae, and it also has sebaceous gland. It is mucosa lined, and there's also the mucosa line part of the nasal cavity, which is a bit posterior to what is skin lined. So when we look at the nasal cavity proper, it has boundaries. We have a lateral wall, we have a medial wall, we have a roof and a floor. So when you look at the picture of the nose, if you can go up. Okay, it's okay. So for the nasal cavity, as we've said, there's a lateral wall, medial wall, roof, and the floor, whereby the floor is formed by the palatine process of the maxilla, which is the anterior 3/4, and the horizontal process of the palatine bone, which makes the posterior 1/4 of the floor of the nose. Then the roof, first of all, the roof is an anterior sloping part of the nasal bones. So externally, we have the nasal bones. So when you go inside into the nasal cavity, we should be able, that part, that sloping that is formed by the nasal bones, it forms the anterior part. And then the posterior sloping part is formed by the body of the sphenoid. We shall be able to look at a picture later on. Then we have the middle horizontal part, which is formed by the cribriform plate of the ethmoid, through which we get the olfactory nerve into the nasal cavity. So this picture should be able to help us. So this is a picture that is showing the septum. This is the roof, and this should be the cribriform plate forming the middle part of the roof. And through this is where the where the olfactory nerves enter the nose through these openings here on the cribriform plate. We say the anterior part is formed by these are the nasal bones. So this is the anterior sloping part. And then the posterior part, which is this, is formed by the anterior face of the sphenoid. This here is the sphenoid sinus. So this anterior bone is what is forming the posterior part of the roof. Okay. So we've been able to see what the roof is made of, and the next thing should be the nasal septum, which we've also been able to look at. and it consists of basically three parts. There's a columella septum, membranous septum, which lies between the columella and the caudal board of the septal cartilage. And then there's what we call the septum proper. That is made up of the osteocartilaginous framework that is covered by the nasal mucous membrane. So when we go back to the previous slide, so this is our septum. It's made up of bone. We have this perpendicular plate of ethmoid bone. We have the vomer, and this is the cartilaginous part. Then anterior to the cartilaginous part, we have a membranous part, and then this is what we call the columella, columella part of the septum. So this divides the nasal cavity into two parts, the left nasal cavity and then the right nasal cavity. So for the septum proper, like I had mentioned before, the constituents include the perpendicular plate of ethmoid, which is posterior superiorly, the vomer, and then the septal cartilage, which we've been able to see. And in other places, it's called the quadrilateral cartilage. So these articulate with the superiorly they articulate with the frontal bone, the nasal bone, and then the rostrum or the sphenoid, as we saw in the picture above. Then inferiorly, anteriorly, there's a nasal spine of maxilla, and then the nasal crest of the maxillary bone, and then the palatine bone, that is inferior. So our blood supply, so the blood supply, we have blood coming from about 5 arteries, where we have superiorly, there's the anterior, this one, anterior ethmoid artery, and posterior ethmoid artery, which come from the ophthalmic artery. And then we have the sphenopalatine artery. And inferiorly, we have the superior labial artery, and then the greater palatine artery. So you find that the arterial blood supply anastomoses at a place we call Little's area here. And it's the commonest place where we have nose bleeding in the nasal cavity. So this is called Little's area, and it's this the plexus formed is called Kisobachus plexus. So we've been able to see what makes up where we find Little's area, and then the arterial blood supply to Little's area. So when we got to the nerve supply of the nasal septum, this image should help us with that. Remember, there were openings here through the cribriform plate where the olfactory nerves enter into the nasal cavity. So you find that this area is called the olfactory area. So because it's supplied by the olfactory nerve. So for this anterior portion of the septum, it's supplied by the anterior ethmoidal branch of the nasociliary nerve, and the posterior aspect is from the nasopalatine nerve. And inferior here, this should be the vestibule of the nose. We have the anterior superior alveolar nerve. So this is from the this should be coming from the maxillary nerve, from the anterior superior alveolar nerve. So for the lateral nose, we've been dealing with the septum, and the other part of the nasal cavity, we have the lateral nose, which is the lateral wall of the nasal cavity, which is also very important. And this is where we find the tabinets. We have the inferior tabinet, we have the middle turbinate and superior turbinate. And this area here, which is corresponding to the ala of the nose, is what we call the vestibule. It's what we described earlier as having the vibrissae in the nasal cavity. So these turbinates have what we call the meatus. This is an area that is lateral to the turbinate. So the space between the turbinate and the wall of the nose is what we call the meatus. So corresponding to the turbinates, we have the meatus. So we have the inferior meatus, the middle meatus, and the superior meatus. So for the inferior meatus, which is corresponding to the inferior turbinate, the opening we have there is the nasolacrimal duct. If we know very well, it's coming from the eye, which brings in tears. That's why when someone is crying or when they're crying, you also end up having a running nose because the tears go into the nose. So the nasolacrimal duct opens into the anterior portion of the inferior meatus. For the middle meatus, we have the opening of the maxillary sinus, the frontal sinus, and then the anterior ethmoid sinuses. For the superior meatus, well, it doesn't always have any sinuses opening into it, but at times the posterior ethmoidal sinuses open into it. And then posterior to the superior sinus, we have what is called the sphenoethmoidal recess, which is a triangular fossa that is above and medial to the superior meatus. If we go back to our picture, it should be around here. This is where we have the recess, the sphenoethmoidal recess, and that is where the sphenoid sinus opens into, and many a time the posterior ethmoidal sinus is also opening to the sphenoethmoidal recess. Yes, so this is it. So you have the inferior turbinate. Okay, we imagine that the turbinate has been cut away. So we are looking into the meatus. So in the anterior portion, we have the opening of the nasolacrimal duct. Then if you remove the middle turbinate, as you see here, then this is the middle meatus. So we have openings of the maxillary sinus. We may have an accessory opening of the maxillary sinus, and then we also have openings of the frontal sinus and then the anterior ethmoids. So the blood supply to the lateral nasal wall, we have branches of the sphenopalatine artery, which is the terminal branch of the maxillary artery coming in. And then when we were looking at the septum, we saw anterior and posterior ethmoidal arteries. So these same arteries, you can see the posterior superior aspect of the lateral wall is supplied by the posterior ethmoidal artery, while the anterior superior portion is supplied by the anterior ethmoidal artery. So we have the vestibule being supplied by the facial artery, and the inferior portion is supplied by the greater palatine. The greater palatine is also a branch of the maxillary artery. So when we go to the nerve supply, the superior portion, posterior superior, we have the olfactory. Anteriorly, there's the anterior ethmoidal. Then we have the branches of the maxillary and pterygopalatine ganglion in the biggest portion of the lateral wall of the nose. And inferiorly, we have anterior superior alveolar artery. And then we have the infraorbital, nerve, not artery, supplying the vestibule. And then there's an area of overlap between the anterior ethmoidal and then maxillary nerves. So when we look at the autonomic nervous supply to the lateral, to the nasal cavity, when we look at sympathetic supply, this is from the superior cervical sympathetic ganglion, which moves along the internal carotid plexus. From the internal carotid, in the intracranial cavity, it forms the Vidian nerves. The Vidian nerve that synapses at the sphenopalatine ganglion with the part of the maxillary nerve. So this supplies the sympathetics to the nasal cavity. While the parasympathetic, we have the facial nerve. Then in the ear, it gives a branch of the greater superficial petrosal nerve that together with the sympathetic supplies forms the Vidian nerve. And this synapses at the sphenopalatine ganglion later to supply in the nasal cavity. So for us, sensory nerve supply, the trigeminal nerve carries the common sensation via the ophthalmic and the maxillary divisions of the nerves. So these ones, depending on the location, where we have the anterior ethmoidal and posterior ethmoidal nerves, that is, those are branches of ophthalmic, while the sphenopalatine aspect that is from the maxillary divisions of the smell, which is in the roof of the nasal cavity. The lymphatic drainage is by the upper deep cervical nodes that drain the nasal cavity. Or this could be directly, or it could be via the retropharyngeal nodes. So the applied anatomy, we have what is called the dangerous area of the face, or the dangerous triangle of the face. Why is it called dangerous? Because pretty much an infection within this area of the face, if not managed properly, it has a way, there's a possible way it can track to the cavernous sinus. So you have the dangerous area of the face described by the lower part of the external nose and the upper lip, which forms a triangle. And the infection from this area can spread to the cavernous sinus through the inferior ophthalmic vein or via the anterior facial vein. This happens because these particular veins, they don't have valves. So that means you can have backflow of the blood and it ends up in the intracranial cavity and then cavernous sinus. So you can end up with the cavernous sinus syndrome. The other dangerous area of the nose is the olfactory area. We saw there were openings into the bone where the olfactory nerve enters the cranial cavity. So you have infection that can spread from the nasal cavity into the meninges along the pia and arachnoid sheath of the olfactory nerve. So it's also, this area is also connected to the superior sagittal sinus and cavernous sinus. So you have infection spread into these different areas if it has not been managed properly. So that was the anatomy of the nasal cavity and the external nose. Sorry. So for the paranasal sinus anatomy, basically these are air-filled spaces within some bones of the face. and they're in direct communication with the nasal cavity through what we call ostia. The ostia is what we found in the meatus, where we had the middle meatus, which is corresponding to the middle turbinate, and then the sphenoethmoidal recess. So there are four on each side and are divided basically into the anterior group and posterior group. The anterior group consists of the maxillary, frontal, and then the anterior ethmoidal sinuses, while the posterior group is made up of the posterior ethmoid and sphenoid sinuses. Okay, so these are the frontal sinuses. We have the ethmoidal sinuses here at the bridge of the nose, and then these are the maxillary sinuses. So when we get this picture that is the sagittal picture, this should be the ethmoids. So the anterior are these. This is the frontal sinus, anterior ethmoids, then the maxillary sinus. This forms the anterior group. Posterior is made by the posterior ethmoids and then the sphenoid sinuses, which are paired. So for the development of the paranasal sinuses, we realize that some are present at birth and some are not. And those that are present at birth are the maxillary and ethmoid sinuses, while those that develop later on is the sphenoid and frontal sinus. For the maxillary, when we get the first radiological X-ray or when they do some form of sinuses, the first radiological evidence of the maxillary is around 4 to 5 months after birth, while for the ethmoid sinus is 1 year and sphenoid is 4 years, frontal sinus is 6 years. So in case of, and this also applies to what you expect someone to present with or a child. For someone who is below 4 years or below 6 years, you don't expect them to have a frontal sinus yet. So you don't expect them to get any illness concerning frontal sinuses. So when we focus on the maxillary sinus, which also at times is referred to as the antrum of Heimel, this is the largest of the paranasal sinuses. It's pyramidal in shape with its base towards the lateral wall of the nose, and the apex is directed into the zygomatic process. It's about 10 to 20 mils, and it's bounded medially by the nasal cavity. Posteriorly, it's the pterygopalatine and infratemporal fossae, while anterior, it's related to the soft tissue of the cheek. The roof is formed by the floor of the orbit, while its floor is formed by the alveolar process and palate. For the frontal sinus, it's situated between the inner and outer table of the frontal bone, and this is pyramidal in shape. Its apex faces upwards, while the base is formed by the floor. Capacity is about 5 to 10 mils. So it also has boundaries as well, where you have the anterior wall being made by the outer table of the frontal bone, and its posterior wall is by the inner table of the frontal bone. So this separates the sinus from the cranial cavity. Its floor is by a thin bone that separates the sinus from the orbit, while the medial wall usually is formed by the septum that is dividing the two sinuses, the two frontal sinuses. For the ethmoidal sinuses, these are thin-walled cavities in the ethmoid bone. Clinically, we divide them into anterior and posterior group. And then the relations, we have still roof by the anterior cranial fossa, which is lateral to the cribriform plate. And then the lateral wall is made by the orbit, that is the lamina papyracea, and then nasolacrimal duct. Inferiorly, we have the maxillary sinus, posteriorly, the sphenoid sinus, medially by the superior middle turbinate. The sphenoid sinus, these are found, there are two, and they are divided unequally by the sphenoid bone, by the bony septum that separates the two sinuses, and they are not usually the same size. You find one is bigger than the other. So still, its relations, we have laterally having the cavernous sinus that contains the third, fourth, fifth, and sixth cranial nerves, the internal carotid artery, and the optic nerve. While superiorly, they are bordered by the pituitary gland, the optic chiasma, and olfactory bulb, and the frontal bone, the frontal lobe of the brain. Inferiorly, they are neighbors to the nasopharynx, and we have the Vidian nerve in its canal. Posteriorly, they are related to the brainstem and the basilar artery. So what are the functions of the nose? Functions of the nose are basically 6, which is respiration, air conditioning, protection of the lower airway, vocal resonance, nasal reflex functions, and olfaction. So we have respiration, which is basically, this happens as air is passing through the nasal cavity. It's warmed, humidified, and this is aided by turbulence that is caused by the turbinates within the nasal cavity. So you find that it's not a smooth flow. So during expiration, we have friction offered at the laminacy and converts it into the eddies. These are basically currents in the nasal cavity. So these aid in warming the air and humidifying the air that is being breathed in. There's what we call the nasal cycle. This is the nasal mucosa undergoes a rhythmic cyclical congestion and decongestion. This controls the airflow into the nasal cavity. So this picture is supposed to help you understand what we've been talking about. You have, when someone breathes in, you have air entering into the nasal cavity, as you see this. So this is the vestibule, and then this is where you'd have your nasopharynx. So air enters through here and goes into the nasopharynx, then down until it reaches the trachea. But we realize this is coming from the lungs and out through the nose. So this one is not, it's turbulent. When it reaches the turbinates, we have eddies current. And this is what aerates the sinuses. That's when air is able to enter the sinuses through the different meatus found, through the different ostia in the nasal cavity. So the other function that we had talked about was air conditioning. And this is done through still the air that is breathed in. The nose is able to filter and purify it and then also adjust the temperature and humidity before it goes to the lungs, so that some microorganisms are filtered out by the nasal vibrissae, and this is around 0.3 to 0.5 microns. So the temperature control is done by the mucous membrane in the nasal cavity, while the humidification is still done by the mucous membrane. So you find that there's humidity added to the inspired air, which is up to 85%, so that you don't breathe in dry air, which would be harder for gaseous exchange in the lower airways. So the other part is to protection of the lower airway, and this is still done by the nasal cavity, filtering out inspired bacteria, viruses, dust particles that get trapped in the mucus blanket within the nasal cavity. And this is pushed to the nasopharynx, and later the person swallows it. What helps or what aids this movement is it's the cilia that beat around 10 to 20 times per second, and this is at room temperature. And then the movement is usually in one direction. The effective stroke is usually in one direction. That also determines the direction of the mucus as the cilia move. So the other function would be the protective reflex, which is sneezing, that is induced by foreign particles which irritate the nasal mucosa. So apart from breathing and respiration, the nasal cavity also aids with the vocal resonance. So it's a resonating chamber for certain consonants, which is the M, N, and NG. And this can be evident the way someone who has a blocked nose talks is different from one whose nasal cavity is patent. So these ones they pass through these consonants pass through the nasopharyngeal isthmus and then are emitted in the nose. So the other is what you call the nasal reflexes. We have the sneezing, which we had talked about. Then the other is when you smell good food, then there's a reflex secretion of saliva and gastric juice. And this still would help with digestion. So the other thing is the olfaction, which again, if someone cannot be able to smell food, well, even that they will not be able to enjoy the taste of food, because olfaction plays a role in testing, in the sense of taste. That's why when someone has a blocked nose or they have a flu, the taste of the food will not be as good as when they don't have this. So this is just the olfactory pathway where we saw where the olfactory area of the nose is, the place that is innervated by the olfactory nerve. So you have stimulus from the olfactory area of the nose, and this goes to the olfactory nerve. From there, it goes to the mitral cells of the olfactory bulb, through the olfactory tract, and then the piriform cortex and amygdaloid nucleus in the brain. Okay, so this is basically the end of our presentation. In case anyone has any questions, yeah, you can ask away.
Thank you so much, Dr. Ruth. There was one question in the group, but it was responded to. Others just raise their hand. Meanwhile, I'll go first. I've been hearing is that we shouldn't
No, I
prevent
can't
ourselves.
hear very well.
Yes, I'm saying the question in the chat which was responded to, someone was asking for the lateral, what are the laterals of the nasal cavity, and was responded to the two sides, the two lateral parts after the nasal, the two lateral parts of the nasal septum. So I was saying that members should
That
raise their hands. Someone was
okay.
inquiring that what are the lateral walls? Lateral walls.
What are the
The
lateral
chat.
walls?
Yes, what is exactly the lateral wall? The lateral nasal wall.
What is the
Then
lateral wall
was
of the
reply.
nose?
Yes, then the reply to him, the septum is the medial wall. Opposite of the septum are the two
Yes.
lateral walls. That was responded to. So I'm saying that members
Okay.
should raise their hand, and I'm not seeing any hands raised. I had a question. I have a question. I'm asking. We have heard that we shouldn't prevent ourselves from like sneezing. Like when you are sneezing and you make yourself stiff so that you don't sneeze. That is a bad thing. I need to understand why.
Yep.
Then also these sinuses that we have. I know some of them. What is important? Everything on our body we have it not by accident. Thank you.
Okay. I believe you've asked two questions. One to do with sneezing, and the other is importance, the importance of the sinuses,
Yes,
right?
doctor. Yes.
So for sneezing, okay, remember the previous slide, we've said that. So the irritation can be by different things. It could be by microorganisms, that could be bacteria, viruses, or whatever, or it could be allergens, for example, dust. So it's a way of the nose trying to protect itself. When you sneeze, you expel some of these things. So it's not entirely bad. Have you got me?
Yes, doctor.
Yes. So that is part of the nose trying to protect itself. Then the importance of the paranasal sinuses. We realize they are found within bone, or these are facial bones. So one of the things that they do, it's sort of like this is not solid bone, so they help to make the facial bones a lot lighter so that we don't have very heavy heads. Otherwise, if it was completely solid bone is heavy, would be having a heavy head. The other function is to sort of act as a shock absorber. When you have direct trauma to the face, this shock is not directly translated to the intracranial cavity because of these air spaces within the sinuses. So that is
Yes.
those are some of the function of the sinuses.
Okay. Thank you, doctor. There are some questions also in the chat. I'll read them for you. This one will
Okay.
say would like to know our lecturer by face. What is the difference
By
between the?
face.
I think they're asking it. What's the difference between the concha and the turbinate? That is from Chintu.
I beg your pardon?
What's the difference between the concha and the turbinate? That is his question.
So
Then,
this is the same thing.
okay.
Concha and turbinate all mean the same thing.
Okay. Is there a working theory on why nasal veins have no valves?
it's not nasal veins. These you find that veins within the intracranial cavity are valveless. So it's not just nasal veins.
Okay. Can someone
Yes.
survive without sinuses? I mean the head in
Well,
fetus.
there are cases of, when we are born, we don't have all the sinuses. And of course, in some cases, we have what we call hypoplastic sinuses, meaning that they're either too small or poorly formed. So yes, there are people who are having either very small sinuses or they're underdeveloped. But then there are also complications related to that. So when someone gets infection, when they fail to drain properly, there are also complications to that. So when someone doesn't have sinuses, it's sort of like an anomaly. Let me say that.
Thank you, doctor. I think those are all, and there's no one who has raised their hand.
Okay. All right. Thank you too. Have a good day.